Okay, we're going to get started. Thank you for everyone who came on time. I'm so grateful. Let me just get organized here. Okay, welcome to this month's No Shame on You Feed Your Mind series. Help. Once a week therapy isn't cutting it for my child. This is a really important session, and it is, please know that you'll get a recording afterwards and you can share it and use it as a resource for your own communities. I'm Wendy Singer, Executive Director of No Shame on You. And on behalf of our board of directors, staff, and volunteers, I warmly welcome you to today's program. If you're new to No Shame on You, we are dedicated to reshaping attitudes about mental health, elevating conversations, and disarming stigma. We fulfill our mission through comprehensive community outreach programs, workshops, team programs, free resources, and a robust presence with over 120,000 social media followers on all of our channels. So if you don't follow us yet, please do. We partner with organizations throughout the Chicagoland area and across the country and are recognized for our inclusive, consistent, and responsive programming to people of all backgrounds. I'd now like to express our gratitude to sponsors who were displayed in the pre-roll slideshow. And before I introduce our speaker, we will have a short Q&A at the end, but feel free to submit questions anytime to me, Wendy Singer at No Shame on You, and I will get them out. And it's now my pleasure to introduce our today's speaker, Christine Hazelett. Is it Haslett or Hazlett?
Hazlet.
Hazlett, great. Thank you. As a compassionate and experienced counselor and expressive therapist, Christine is a licensed LCPC and a registered art therapist, and has had the privilege of guiding individuals, families, and couples through life's challenges for over 20 years, with expertise in didactic, developmental, emotionally focused, and attachment-oriented therapies. Christine helps clients overcome communication struggles, trauma, and attachment disruptions. With a BFA in fine arts and art education and an MA in art therapy from University of Illinois Chicago, Christine is dedicated to continuing her professional growth and providing compassionate, effective support to those that she serves. And she is currently a clinical director at Clarity Clinic in Evanston, which is an awesome org that has multiple locations throughout the Chicagoland area. Thank you, Christine, and you can take it away.
Thank you. I'm going to share my screen. Um, and the screen I want to share. Sorry, there are too many things going on. All right, so I'm Christine. I am many things. I am a mom. I am a therapist. I am the clinical director of a higher level of care program. I actually oversee the programs here in Evanston and also Arlington Heights. In Arlington Heights, we have adult and adolescent PHP and IOP programs. In Evanston, we currently have an adult PHP and IOP program. And I am here to talk to y'all a little bit today about higher level of care, about a lot of things, but mostly higher level of care with our teens and young adults. Um, how do we know we need that? What to look for, what types of struggles, how to navigate through that, how to communicate openly, both with our child and with treatment providers, um, to better get a handle on what supports are available to you. I think, in my experience, adolescents are really struggling with anxiety and depression. I have seen more panic in the last 10 years than I saw in the first 15 of my career, amongst young adults and adolescents. There's just an escalation in anxiety. So, needing more support and needing more foundational skill development is more and more important. And we at Clarity, as well as many other higher level of care programs, but we at Clarity for sure are really committed to creating individualized, a higher level of care programs so we can really help people build the skills to support their struggles, the skills that are really going to be most meaningful and useful for them, and helping them figure out how to best apply those skills. So, a higher level of care is something that um, I think can strike fear into the heart of many people. Like when we know that our loved ones, especially our children, are struggling and struggling big, that is scary enough on its own. And then to think about something like, they need therapy. Okay, we're doing therapy. Okay, therapy is not cutting it. Therapy is not giving them what they need. It's not stabilizing the feelings or the experiences or the shutdowns or whatever we're seeing. Um, then we have to think about what else is there. And when we start to look into what else is there, things come up that feel very scary, like inpatient and residential, which we'll talk about a little bit. But the thing in between there, the space in between, is what higher level of care occupies. So, where I'd really like to start is, if I can, is just objectives. So these are the things I'm hoping to cover. If I miss something, because I'm notoriously horrible at following a PowerPoint, I tend to go off on tangents and be a lot more conversational. So if I'm missing something, bring me back on track. If I don't get to something that you really want to hear about, please let me know. Um, I'm open to feedback of all kinds at any point in time. So I want you to really be able to understand how to recognize warning signs. So when to really know, is this just a moment of bigger struggle, or is this an ongoing bigger struggle? So that you can more effectively talk through choices and access the supports that you need. Um, Understanding the difference between the levels of care programs is also really important. So you know what's being recommended to you, you understand the ins and outs of that, and you can make decisions accordingly. Nothing is set in stone with clinical recommendations. It's always open for communication and conversation. So we're going to talk a lot about that too. Like, how do we collaborate and how do you get to have a voice in the process? But most importantly, how does your child get to have a voice in the process? And how do we help amplify that voice? And then practical next steps. So where do you go from there? Like once you've decided, okay, I think this really is necessary and I'd like to explore this, what are the next steps and sources of support? So again, if I miss a step, let me know. Um, so warning signs are complicated. And the reason that they're complicated is because mental health is different person to person. Nobody experiences symptoms in exactly the same way, even though we can medically diagnose and we can medically prescribe that, things to help offset symptoms. Everybody's symptoms manifest in slightly different ways because as human beings, we are perceptive, and we experience life in vastly different ways. So two people can have exactly the same experience, but they're walking through that with a different concept of it and a different perception about it and a different perspective on it. And all of that impacts the way we manifest mental health symptoms too. So keep that in mind as we're talking. And if you have anything, question to add or something to highlight, please, let Wendy know and we'll lead, kind of lean into that discussion. Um, Something that's always really important to pay attention to is what's different. You as the parent may not see it, but friends might, coaches might, teachers might. As our kids become teenagers, we as the parents spend less and less time with them. So we aren't necessarily going to notice the nuanced changes the same way they did when they were 5, 6, 7, 8 years old and they lived in our back pockets. So we want to, like, if we have a sense that something's up, if something starts to feel different to us, the first thing that we want to do is talk to our kid about that. But then we also want to check in with other people that they're exposed to, a best friend's parent, somebody that they're dating's parent, a teacher at school, a therapist if you have one. Like, I'm concerned about this. Is this a change that just I'm noticing, or is this a change just in their relationship with me, or is this a more generalized experience? So we want to pay attention to changes from the norm. That can be like all of a sudden they're just super surly, or they're super withdrawn, or they're real gregarious and outgoing and much more conversational and trying to like be really close to you all the time when you haven't spent that much time with them in months. Things like that are notable changes and not necessarily concerning, but definitely something to take note of. And as we're moving through this, I just want to, kind of highlight that we're looking for many things, the presence of many things, not just a singular thing. Um, when we have in my world, when we're assessing, we're looking at domains of functioning, and those domains of functioning are for adults, their work, home, and uh, social. And for kids, that's school, because that's really their job. Although teenagers may have a second job. Um, and then it's home and social. So home incorporates a lot of things. Home is the place where like hygiene and self-care, are we eating? Are we sleeping? Like we call those in my life ADLs. So activities of daily living is what that stands for. So if you ever hear these things, that's what we're talking about. And we're really looking at that to assess functioning. So those are also things that contribute to changes. So we want to make sure that, we're paying attention to the changes in all three of those domains. The more changes we see that are impacting, if it's impacting one thing, then okay, maybe this is just a school struggle. What's going on at school? How can I navigate that? But if it's school and home, if it's school, home, and social, social's the big one for teenagers that we really need to pay attention to. Are they isolating? Is there a lot more conflict in their relationships? Things like that. So when it's all three domains, then we're much more concerned. If it's one, if it's two, depending on the level of disruption, then um, it's not necessarily a big issue, but how generalized it is, how globalized it becomes. So when I'm talking about changes from the norm, it's looking at all of those things, not just a singular event, but many events. We want to pay really close attention to suicidal ideation and self-harm behaviors. Self-harm behaviors can take a lot of forms. Often now, when we think about self-harm, we think about cutting, but it can be any number of things. It can be self-flagellation. It can be cutting. It can be burning. It can be pinching. It can be bruising. Any of those things that are done with the intention to bring pain. That pain's intention is to create distraction and relief from emotional pain. Um, those are self-harm behaviors. Other things that can fall under self-harm are how our disordered eating behaviors or substance use behaviors that become destructive and disruptive that a person is doing with intention in order to gain relief from emotional pressure or emotional burden or negative emotional experience. New increased substance use. So substance use is a tricky one and, definitely not something that I'm condoning, just something that I'm offering as normal in today's day and age. THC use and alcohol use are very common, and that doesn't mean that it should be expected, but they are very common. So is it an escalation in that use? Is it new use? Is it experimentation with a different substance? Is it risky experimentation? So like, are you hearing a report that your child at a party accepted drugs or even THC in some form from a peer, but they have no idea what the source was, right? Like that's risk-taking behavior. So if it's something that is beyond the norm for your child, again, something to pay attention to. Big changes in eating habits or sleeping habits. Are we sleeping way too much? Are we not sleeping at all? Are we having a lot of trouble falling asleep at night? Are we having a lot of trouble waking up in the morning? Are we eating more than normal? Are we not eating at all? Um, and is there purpose behind those actions? Are we staying up really late because we're trying to communicate with a friend online, and getting caught up in something? Or are we just having trouble falling asleep and then reaching out to friends because we need occupation? Um, so the whys also matter, especially when we're talking about things like substance use and changes in other ADLs. Hygiene matters also. When we're noticing, the other thing to pay attention to is a decline in functioning. Are is are they isolating? Are they not doing their schoolwork? Are they not attending sports practices or clubs that they would normally look forward to or that they would normally attend? And understand too that it's really normal for interest in things to wax and wane. But if there's a decline, and not just like this week, but if there's a decline over many weeks or months, then it starts to become concerning because in adolescence, they are interested in different things and they're looking at different things for different periods of time. They're kind of trying stuff on and figuring out identity and where all of that fits together. So, it's again, different person to person. The most important thing in all of this is to trust your gut. You spend a lot of time observing your child, and that is a beautiful thing and also a stressful thing. Um, but even intuitively, even if you don't see them very often, you are intuitively aware of nuanced changes in their behavior, in their demeanor, in their interactions. Trust your gut. And the follow-up to that is um, ask questions, engage, ask questions, don't isolate. So these are just some more examples of behavioral changes to note, um, just to highlight some in case you needed more examples. Social withdrawal or isolation, avoidance, especially avoidance of things that are supportive to them. So like, I have kids that are athletes, and if they start avoiding sports practices, I'm going to be like, huh, what's happening? Right? Because that is actually a source of support for them. It's not a source of stress. It's something that both of my children engage in because it's life-giving for them. Sometimes for kids, sports start to feel really stressful and competitive, and they're not interested anymore, or that feels like too much for them. But if it's something that feels life-giving to them and they're all of a sudden avoiding it, like, I don't want to go to therapy anymore when they've had a good relationship with their therapist, or avoiding school, avoiding family dinners, not wanting to spend time with friends or do things or go out with a significant other if they're dating somebody. Things like that that are avoiding supportive people or interactions with supportive people is definitely something to pay attention to. Clearly, sudden changes in mood, sudden changes in affect, that can have a lot to do with just a one-off life experience, but definitely something that we don't want to ignore. So when we're thinking about like how do we assess these things, how do we know if something is problematic? When we notice a change, we want to be curious about it. Um, Decline in hygiene is a big one. So a lot of early adolescents have a really hard time with hygiene practices, right? Like I remember going to a presentation at my kids' middle school, and that this like pre-middle school presentation had like a huge slide about deodorant. And I was like, oh, right, because they don't know about it yet, right? Like they may not have hit puberty, and so they don't have that issue yet, but they start to get stinky over the course of this period of time. So early adolescence, like hygiene issues are much more just normal. But as they get into high school and certainly emerging from high school into college or whatever comes after high school for them, if there are hygiene changes, if we're not showering or brushing our teeth on the regular, like that's something that we really want to pay attention to and be asking about. Because that is definitely not the norm for that age. Um, and risk-taking behaviors. This is a big one too. So if your child has never been super impulsive, like I have one that's very staid and one that's very impulsive. So like I don't worry so much about the impulsivity, but do worry about risk, right? So if he's doing something that is just like blurting something out in class, not concerned about that. If he's doing something that's just like thoughtlessly dangerous, like jumping off, I don't know, jumping out of a second story window into a kid's pool or a trampoline. Like those would be more concerning because they're thoughtless and can be problematic in general, right? But also can be symptomatic of an escalation of anxiety, an escalation of or development of bipolar. So if there's mania or hypomania, so those are things that can be amplified and things that we want to pay attention to. So how do we pay attention to them? Um, Communication. And this is big. I have very rarely worked with parents, and I include myself in this too. Like, I've very rarely worked with parents that think that they don't communicate with their kids or don't communicate effectively with their kids. And the place that I challenge myself consistently, and the place that I will offer a challenge to you or just an opportunity for observation is how often, when you are engaging in communication, are you asking your kids specific questions? How often are you asking general questions? How often are you asking very closed-ended questions that are yes or no? And how often are you considering the things that you're noticing of them when you ask them questions or when you engage with them in communication. Um, the other thing to really lean into, especially in this topic, and when we're talking about emotional well-being and assessing levels of care and assessing a potential escalation of care, um, we have to ask hard questions. And the hard questions make us uncomfortable for a lot of reasons. But um, it's really important to always engage with curiosity, not judgment. So try not to make a statement. Try to ask a question. You can make a statement first to explain why you're asking the question, like, "Hey, I've noticed some changes in you, and I'd like to explore that with you. Is that okay?" I think asking for consent can always be really helpful. Because if it's not a good time for them, it doesn't matter how you ask the question, it's not going to come out okay. But if you've tried a couple times and they're still saying, no, I don't want to talk right now, then you may need to say something like, hey, we're going to have a conversation because the things I'm noticing are starting to concern me. I love you, and I want to be able to be a support for you. And then name what you're noticing. Um, it seems like you haven't been showering consistently. Is something going on? Which is a yes or no question, but it's a starting point, right? Um, how are your emotions? Can you tell me like a couple of the biggest emotions that you felt today or have felt this week? Try to name things specifically. If you notice that they're isolating from friends, you haven't been communicating with your friends as often. Um, is something wrong? Are you having a falling out with them? Did something happen? What happened? Um, it's you're opening doors, you're opening lines of communication, and curiosity is the best way to get there. If we make statements that are judgmental, like, you need to get out more, you haven't been doing anything with your friends, we're not really eliciting an emotional response. And we're making a judgment. Like, you should be social. You should be social all the time. So why aren't you? Like, what's wrong with you that you're not being social? And maybe they're tired. Maybe that they have had a falling out with their friend group, or their friends are, doing a lot more partying and drinking, or have started vaping or using THC. And they don't want to be a part of that. And so they're feeling alienated, right? Like, there are a lot of reasons that these things can come up. So when we engage them from a place of curiosity rather than judgment, we're helping like facilitate a supported conversation, and offering them an opportunity that, like, I can imagine there are a lot of things going on. I'd really like to know from your perspective what actually is going on. Um, when we're talking about emotional things, like when we're noticing concerning behavior, even risk-taking behavior. So let's say it's something like much more egregious, like getting behind the wheel of a car and driving home after they've used a substance. That's a big deal, right? And I'm not saying there shouldn't be consequences for that. The consequence is not the starting point. So we want to avoid many things. One, like, we want to address that behavior, even if it's really challenging. We want to make sure that that our child feels seen. I see that this happened. It's very upsetting because it doesn't feel like you to me, and I don't understand the decision making. Can you help me understand what was going on? Um, Try to get some information first. Two things that are really important. We don't want to make concessions. We don't want to give it like the one-off. Well, okay, I understand where you're coming from. No problem. It won't happen again. We can't take that chance, right? Because getting behind the wheel of a car under the influence of a substance, we all know, one, is illegal, two, is very dangerous. And it's just a matter of time before someone gets hurt. So we don't want to give concessions. That's also true when we are aware of our child having self-harm behaviors or disordered eating or suicidality. We can't avoid those subjects. We need to address them, and we need to address them directly, even when it feels scary to us, even when it's a difficult topic to talk about, even when maybe we are not perfect in that way either, or we've set a bad example. for self-care or decision making. We're humans as parents. One of the hardest things we have to do with our adolescents as parents is own our own flaws and faults and say, like, this is a situation where we have to talk about your behavior and we can also talk about mine, but right now we're talking about yours. And keep those open. We need to be willing and able to ask very specific questions too, especially in the case of self-harm and suicidality. Um, we need to be checking in with our kids very regularly about those thoughts because those thoughts almost always are ever present. Sometimes they're quiet, sometimes they're loud, and we need to be checking in about that. And so instead of asking, instead of asking my child, how are you feeling today? It's really important that I'm specific about what feeling I'm talking about. How are your thoughts and feelings of depression today? Where are you noticing that in your body? Is it making you feel really heavy and tired? Is it standing out in some other way? Is it activating your thoughts in a certain way? How are you feeling? In the case of suicidal ideation, how are your suicide thoughts today? I use loud and quiet as a spectrum. So like where are they at in the scale of 1 to 10, 1 being quiet and soft and 10 being extra loud and hard. Where are your suicidal thoughts today? Important thing to know about self-harm is self-harm urges always start as thoughts. And so always there is rumination surrounding self-harm. And most kids, most people who have self-harm behaviors are thinking about it and really trying hard to prevent the action from happening for a long time before they actually they give into it and take the action. So if we are checking in with our kids regularly about self-harm thoughts in that way, just like where are your self-harm thoughts today? How loud or quiet are they today? How much pressure, weight are you feeling?
Christine, we have a question that did come in about self-harm to me.
Yeah.
The question was, is self-harm a new thing, or did we just not know about it when we were kids?
That is a complicated question. There isn't a super clear answer. I think a lot of things have existed for a very long time. I mean, just think about even PTSD. Post-traumatic stress disorder it's a relatively new diagnosis. Trauma has existed since the dawn of time. Autism spectrum disorders are now labeled as that when like they've existed for forever. Um, so some things and self-harm, I think, it's an impulse and an urge that has existed for a very long time, and is much more front of mind now, in part because of media culture, in part because of just our naming of things that are mental health related. So, but I also believe that it's been amplified. The presence of it has amplified, um, because of the presence of depression and anxiety in youth culture. Um, so I think the two things do go hand in hand, although there isn't always direct causality. Often the two things go hand in hand. Trauma, stress, and anxiety are the three largest things that contribute to self-harm behaviors. And that's the spectrum of self-harm behaviors. So that can include it can include substance use and disordered eating in some respects. So that's a great question, and I'm sorry I don't have like a real definitive answer to it, but it's a yes and. I think it's both. And thank you for that. Thank you for that
Thank
question.
you. I think you answered it really well. Thank you.
Sure. Um, What is also really important is the more of these difficult conversations we have with our kids, and this also includes conversations about things like their sexual health and sexual well-being. Um, Difficult, like all of us feel a little touchy and prickly talking to our kids about sex. Sometimes we feel touchy and prickly talking to each other about it. It's both an amplified and a shameful topic at the same time, and it's so conflicting and confusing. But also really important because one of the places where risk-taking behavior can happen when mood is problematic or mood is disordered is in sexual risk-taking. Kids will seek connection with others in any form they can take. Sexual release is one of the things that can give people temporary relief from mood disorder symptoms. So those are conversations that we want to have with our kids regularly too, is just how are your dating experiences going? Are you exploring sexual partnership? Is there anything you need from me to help support your safety in that part of your life? And these are tricky topics, or can be, depending on our families of origin, how we were raised, how we were taught to communicate about these things. And definitely something that, the therapist in your life, whether that's your kid's therapist or your own, or even someone like me that you can call as a community resource and support, can help walk you through some of those conversations, especially when this is a sticky one for me. Like this makes me really uncomfortable. So it's also always okay to own that when you're trying to talk to your kids about something hard. You can say, this is really hard for me to talk about, but it's so important that I'm going to deal with that discomfort. So if it feels awkward, for me too, babe, like just make sure that they know like you're human and this is hard, but we're going to do it anyway because it matters that much. And especially with things that concern safety. So substance use, disordered eating, or disordered sleeping, self-harm, suicidality, homicidality, anger, eruptive anger, disruptive anger, any of those things that can create harm and can create harm quickly, we want to make sure we don't avoid them just because we feel stuck and know that there are resources available to support you in that, myself included. Um, Um, so these are some resources. And I know that Wendy's going to share the slide deck with everybody and on the website. So I want to make sure just to highlight these. These are some national resources that are really well founded and really, really strong. So like there's a research foundation behind them. There's a lot of inter referral and a lot of different forms. So one that's particularly helpful, like if you're concerned about your child's substance use, for example, SAMHSA is a fantastic resource, and there's so many resources on this website. This one links you specifically to like the parent portal. Um, Mayo Clinic has great resources as well. That's more of like identifying the signs and symptoms that something is going wrong. So there are some checklists, some things to go through. I would always encourage you, though, instead of just doing surveys like that on your own, ask the questions of your child. So make it a collaboration. Preempt it with like, these are the things that I've been thinking about, and I really want us to find the best sources of support for you. 100% of the time, treatment is successful when kids have buy-in. If they don't have buy-in, treatment is not going to be successful. I have a program full of adolescents right now. There are 9 of them. Of those 9, 3 have said multiple times, I'm only here because I have to be. And they all disengage from program. They don't want to be there. They have not bought in. So the more of these conversations we have directly with our kids, the more actively we are engaging in communication with our kids about this is what um, this is what I'm thinking. This is what I'm worried about. Like here, this is what I'm noticing about you, babe. Like, how are you actually feeling? Let's talk about the emotions. You seem super angry. Are you feeling anger, or is it something else? Anger, as most, as many of us know, I'm not trying to act like you don't understand this, but like anger is a defensive emotion. It's a secondary emotion. It pops up to protect us when we're vulnerable somehow. So if you're noticing an increase in agitation, there's something underneath that we want to get to. We get to it by curiosity, engaging them in a conversation and not making assumptions about what's going on with them, but truly, genuinely engaging them from a place of care and concern. And I love you and I want to understand. And so these resources are phenomenal and also a starting point for some of those conversations. If you want to get deeper, if you want, your kid to understand too, like, oh, I didn't realize that my depression had gotten this pervasive or was happening in so many different ways in so many different places. Or I didn't realize I was feeling anxious everywhere, and that's why I don't feel like going out with my friends at all right now. Um, the more we open this conversation up to them and aren't just using the tools ourselves, the more we're facilitating that buy-in for them, that there is help for it, that they don't have to sit in it alone, that really none of us do, and that we're all in it together. Which
Christine,
brings me to,
I have
yeah,
another question that came in.
yeah.
It said, do you have any suggestions on how to know when it is time to change a provider? Like how to differentiate between avoidance behavior versus not buying in? Great question.
That is a great question. And I think,
And another comment, avoidance behaviors being the child doesn't want to engage with therapy versus not connecting with the therapist.
yeah. So, I mean, I think those are questions we can ask really directly. So I've noticed that you are more and more resistant to going to your therapy sessions. What's going on? Like I've had this issue with both of my kids actually. And so it, and there isn't like a one way to deal with it or a right way to deal with it, but that relationship between your child and their therapist is theirs. And if something is going wrong in that relationship, what I would always, you can definitely be curious about it. You can offer, like, would you like for all of us to sit down and have a conversation about how therapy's going? Do you think it would be helpful to check in about goals or progress? If you don't feel like you're getting anywhere, that it's changing anything, that's something that's important for your therapist to know. And to be honest, um, like the therapist should be noticing that and bringing that into the room as well. And so if they're not, that in and of itself is cause for concern. Um, but a reason to have a conversation because it is absolutely okay to, and important sometimes, to change a therapeutic relationship, to say goodbye to one so that you can open up a door into a new one that might feel more productive. It's always best when that happens in thoughtful and intentional ways. So talking to your child about that you're noticing the resistance, you're not trying to name it that what the resistance is about, just that it's happening. And see if they can name what the resistance is about. I don't really like this person, or they don't really listen to me, or they seem to always be on your side. Um, or I'm not, it just doesn't help. Like I go, but we talk about the same thing every week. It's not doing any good. I'm not noticing any differences. Asking questions of your child about like, do you know what your goals are in therapy? Like, have even you and your therapist talked about your goals? It's really hard to know that you're making progress if you don't know what the goal is, and your therapist and you aren't checking in about that on a regular basis. So engaging in that kind of discourse first, bringing the therapist into it or encouraging your kid, especially like the older they get, the more that relationship really does need to be theirs and stay theirs. But also, if they're not willing to engage their therapist in that kind of conversation, then it's definitely not the right fit for them in terms of the therapeutic alliance. Um, Hard things. I mean, the number of times that I have been actively challenged by my adolescent patients, um, like horrifies a lot of parents, but I'm like, oh, good, they trust me. Like they're telling me I suck. This is awesome. Which sounds really weird, but it's true because when they're telling me I suck, I can do something about that, right? Or I can tell them, I hear you. Maybe I'm not, my personality just isn't the right fit for you, or the way that I approach therapy isn't the right one for you. Let's find you somebody that feels like a better fit. So we're still in alliance, even when I'm not the right choice. My goal is still to support them. And I know this is how, this is how therapists feel. We're not always all very successful in conveying that, especially with adolescent patients, but that is really important. So opening up that dialogue, letting them be a part of the dialogue, and really letting them drive the dialogue if they can. But also letting them back out of the relationship in whatever way they need to. So if they want to ghost the therapist, and that's not the healthiest choice, but if that's the only choice that feels accessible to them, and that allows them to open up a door to a different level of service or a different type of therapy or a different therapist, um, that closure needs to happen in one way or another. I hope that answers the question and makes sense to everybody.
One follow-up question came in,
Hmm.
and it's just, is there ever a point when you're with a therapist too long? Like, any
Yes.
thoughts on that?
Yes. I am like historically, I am a therapist who works with trauma. And so many of my therapeutic alliances I've had for years, and some of them I've had for decades. And um, for the folks that I've been with for a long time, we check in monthly about how are we feeling about this relationship. Is this still what you need? Is this still working for you? What else exists? So 100%, there is there is a time when we're ready for something else. We need something different. And we should be having conversations about that regularly. Um, I switched therapists, personal story. I switched therapists when my kids started elementary school because I had a lot of social anxiety surrounding parenting and connecting with other parents. And the therapist that I was working with was not a parent. And I felt like I need someone who has a parenting perspective, who can help me put this into a context. So, in my own journey in therapy, that change was necessary for me. And I talked to my original therapist about it. And we had a good discourse, and she actually helped connect me to the person who still is my therapist. So I think that's all part of like why I'm leaning so hard into communication in this conversation is because that really it matters. It matters in healthy relationships. And to help our kids access the services that they need, we want to promote healthy communication, especially healthy communication around difficult things. And needing to change therapists can feel like a really hard thing because it feels like a rejection. I've also had people tell me, I didn't want to hurt your feelings. I'm like, okay, thank you. I appreciate that you're considering my feelings. And also, your feelings and needs in this situation are greater than mine, and I'm here to support you. And that's how our mindset and our mentality should always be as clinicians, if that makes sense. Okay. And I am sensitive to time. So I'm going to try to buzz through this real quick. It is actually pretty quick. So higher levels of care can mean lots of things. What we have here at Clarity Clinic and what most higher level of care programs in our area have are PHP and IOP. The escalated level above PHP and would sort of happen after if there have been several inpatient stays that haven't been successful is residential, which is a longer term inpatient stay. It's not permanent, but longer term, just for stabilization, for safety. I'm not going to talk as much about residential because it's not as commonly needed, but sometimes it is necessary and important to know that it exists. So in IOP stands for Intensive Outpatient. PHP is Partial Hospitalization Program. Um, and the difference is, so IOP would be the step up from outpatient therapy. If we are noticing that we're in outpatient therapy, we have been and we've been going consistently, and my symptoms are just not getting better, even with medical intervention. So let's say I have an outpatient therapist and I have an outpatient prescriber. I'm on medication to try to help stabilize my mood. Still not, I'm still not feeling stable. I'm still struggling with my activities of daily living. I'm struggling in two or three of my domains of functioning, like we talked about earlier. Um, then you would step up likely into IOP, which looks like 3 to 5 days a week of 3 hours or 4 hours of programming. That programming is largely skills based and based in practices of dialectical behavioral therapy, cognitive behavioral therapy, and sometimes in our program is an example, acceptance and commitment therapy. We also use yoga therapy and expressive therapies to help solidify the skills, practice the skills, teach the skills. So all of those CBT, DBT, and ACT are all skills-based methods for treatment. And what they really are doing is helping people learn about their behaviors and the related thoughts and actions that they've developed over time for coping, but have become maladaptive or have become unhealthy for them. and maybe disruptive or destructive, and helps them replace that with more thoughtful, mindful, intentional actions and behaviors. So the reason that it's 3 to 5 days a week is because it takes a minute to learn those skills and it takes a minute to practice them. And if we're only meeting with a therapist once a week for an hour, we don't have enough time to learn and conceptualize the skills and put them into practice in a way that we have an accountability measure quickly to help us see this is working or this isn't working and help us identify what's actually going to work best for us. PHP would be the next step up. So PHP is sometimes it's a step down from inpatient care, and sometimes it's a step up from IOP. Sometimes people step into PHP directly from outpatient. That would happen when there's a significant safety risk or our activities of daily living are so severely impacted that we're really not functioning. So we're not able to get to work or go to school. We're not able to socialize with our friends or experience pleasure or joy from any of that. We're isolated. We're really struggling with functioning. And PHP is 5 days a week, no matter what. And it's anywhere from 4 to 7 hours a day. So think about it like a work day or a school day. Um, Much more intensive. And the reason for that is because we're not just teaching skills in PHP, although we're doing that. We are also really working on stabilization. So a patient is often working with a prescriber and seeing a prescriber weekly and having consistent evaluation and revisiting medications, how they're working, how they're not working. We're also doing daily goal setting. So in IOP, we're doing weekly goal setting and checking in. In PHP, we're setting a goal every day. We're acknowledging this is how I feel today. This is where that lives in my body. So somatically, how am I experiencing the mood and the feelings? And then also, what is accessible to me to use to manage those things today? So we're taking it one day at a time, and we're really building up the strength and the skills and the strategies much more intensely and much more intentionally, if that makes sense. Residential is 24/7 care, and that really only happens when everything else has kind of been exhausted. So either there's a tremendous level of resistance to treatment, and it's just going to take a lot longer for the person to open up to the opportunity and the skills presented to them. Um, or their symptoms are so severe that their safety can't be guaranteed. Um, so they can't do a day type program where they're going home at night. So those are the levels of care and a little bit about like how we decide between them. Um, so what you do as a parent to help facilitate the process and determine, so the first thing you do that we talked about at the beginning is you're noticing. You are paying attention to what is going on. You are sharing with your child what you are seeing. You're not hiding what your thoughts are from them. You are letting them know in a caring, considerate, thoughtful way. You're not judging or criticizing. It's not, what's wrong with you? It's, I can see that you are struggling. Can you talk to me a little bit more about that? What are you feeling? Where does it live in your body? Um, is it emotion? Is it sensory? How are your thoughts? What are your thoughts doing today? Even with things like anxiety and panic, thoughts can be really disruptive, distracting, and destructive. So when we're checking in with our people about their thoughts, what they're thinking, how they're thinking, it opens up doors to talking about the emotional experience. But the other thing that I really like to emphasize with people is that element of where is it living in your body? Because emotions, like intellect lives up here in our brain, it's in the front. Emotions come from our lizard brain. It's a much more instinctive process. Our lizard brain speaks in the language of the five senses. And so when we're having an emotional reaction, our five senses are involved. So we want to make sure that we're helping our kids and even helping ourselves when we feel dysregulated, connect with our physical experience of it. So asking them like, where are you feeling that? And what does that need? Is it going to be helpful to rest? Do you need a warm shower? Do you need to step outside and take a walk? Does your body need movement? Like, what do you need right now? Can help them see past just the mood and being stuck in the mood and help them find an action to take. So you're going to share what you're seeing and you're going to talk about it. You're going to establish and maintain boundaries, and you're going to hold those boundaries with and for them, and be really curious when they are pushing against the boundaries or they're not observing them. The more they're pushing back against limits, the more you should be concerned because, and I mean, adolescents are going to challenge our rules, right? That's their job. Their job is to challenge us. They're trying to define things for themselves. They're trying to develop agency. We want them to do that. That is normal. It's when you have said, hey, we're going to eat. We're going to eat dinner every day, or we're going to eat breakfast every day. And they are just routinely not eating breakfast. Then the conversation is like, okay, breakfast doesn't seem to be working for you. Is there a different time of day you feel like appetite would be better and we can make sure we're eating? So it's you're not discounting their agency and their ability to exert not breakfast. I want dinner. You're just checking in with them about it and noticing that there's a stuck point, if that makes sense. So we're going to establish and maintain the boundaries. We're going to be checking in with them about it regularly. We're going to stay present and involved, especially when it's hard, especially when it's even triggering for you. That's a sign that you also need support, um, because it's hard and it's triggering. It is really hard to see our kids struggle. There is no greater challenge in parenting than seeing our kids struggle. That is real. Lean into it. Try not to lean away from it. Even when that means confronting stigma or confronting someone else's opinion of like, oh, they're fine. You don't need, you don't need more. They don't need more. If you're concerned, trust your gut. You know them intuitively and instinctively better than anyone. So pay attention, and stay present with that, even when it's hard. And definitely be a part of the treatment team. Don't let yourself be locked out of conversations. Seek them. If they're not offered, they should be offered. But if they're not offered, seek them. Push in. I tell my clinicians in program all the time, like, parents are going to reach out and you are going to respond. Like, it's essential. The kid is not going to do well in treatment if the parents are not involved. We in our adolescent program have a multifamily support group that happens every week, once a week, that is a strongly recommended or strongly encouraged part of our program. We don't mandate it because some people can't make it happen, but we really do strongly encourage it because it offers an opportunity for support. Everybody's learning the same language. Really important for you to be a part of the treatment team and be a part of the conversation. Um, Barriers are fears, our kids' fears, resistance. Sometimes that's resistance from the outside. Sometimes there's cultural resistance that comes from stigma or opinions or thoughts. Um, there are lots of ways that resistance can come about, and we have to be curious about the resistance, but not give into it. I tell my kids all the time, and this is a mantra in my work, but in my house, we are not going to let the worry win. Worry is there for a reason. It's giving us a warning. We need to investigate. Do we need to be afraid? Or is this just something that's new and unfamiliar and we need to learn more? We need to ask more questions. We need to dig deeper into it. But we're not going to let the worry win because when we give into it, if we let it back us down, it gets stronger and louder every single time. And then it becomes harder and harder to work through. So we're not going to let it win. We're going to push through. We're going to push through the resistance. We're going to push through the fear. Um, Doubts. You may be like, is this really necessary? This is where you have to lean into the admissions process. The intake is not going to admit your child or you to a program that you don't actually need because we have to prove medical necessity to your insurance company for payment. So if you don't need it, it's not going to happen. And they will make referrals for other options for you or for them. So keep that in mind. Like, hold on to that little nugget because that's real. Doubts are normal. And doubts are normal because it's scary. Fear plants doubts in our minds and our hearts, right? So we have to push past that fear and investigate, combat fear with fact. What happens next is you reach out. You reach out to programs and you're interviewing. You are interviewing them. You need to know, is this program a good fit for our family? Not just your kid, our family. Because when we're talking about kids, the family piece matters. Are they going to be supportive of you? not just your kid. You are interviewing. So when you call places, when you call an intake number, ask them questions. Ask them questions about these are the symptoms my kid is experiencing. This is what they've had in therapy so far. Do you work with this? How do you work with this? How do you work with the families? Whatever questions feel important to you, but more importantly, whatever questions feel important to your child, highlight those, amplify that voice, make sure that you assert it. So that's step one is going through the assessment and recommendations process. Do you feel comfortable with those recommendations? Take time to think about it. Take time to ask your support providers. All of that matters. Review your insurance, make sure you have coverage so that it's financially feasible. And then decide which program you want to admit them to if it is evident that that's necessary. Um, and then make sure that you're transition planning. So keeping all of the providers connected, the program should do this, but you want to be involved in it. So make sure that releases are signed, that people are talking to each other so that the kiddo has as comprehensive a support as they can during program, but also after program. Um, and that's it. 3 minutes to spare. So are there any thoughts or questions? Anything you want to know from me? Anything that I didn't cover that I promised to?
Just thank you. Thank you. I think that we learned a lot, and I appreciate you sharing some of your own stories and experiences because it's not being a parent is wonderful and also very challenging, and it can be scary at times, and we're all humans and doing the best we can. And I appreciate also the comment about trusting your gut as parents. I appreciate that a lot. So thank you. We don't have any additional questions, so I'm just going to close up. I threw in the chat just a short survey. If you have a minute, it helps us make sure that we're on the mark, and we will share it with you, Christine, for feedback as well. And for those of you who are new to No Shame on You, we do these once a month. And next month, our session is on Thursday, April 30th. And we are partnering with an awesome organization called Canines for Comfort. And we're going to be learning about emotional support animals, what they are, how do they help support people who are struggling with their mental health and well-being. And so we're super excited about that. And if you don't follow us, please follow us on LinkedIn, Instagram, and Facebook. And thank you, Christine and Scott, both with Clarity Clinic, for all you do for our community. And we'll see everybody soon.
Thank you. Thanks, everybody.
Thanks, everyone. Have a great day.